I love character building exercises. Hi, Marianne. Can you take her for a margarita when she's done? Thank you. I would appreciate that. How do you want to do this? Do you want to do one big example and then? Yeah? Okay. All right, folks. May I have a practice patient? That is French for patient. All right. You got it. Hi. Okay. Let's go right down the list. 14 by 17, lengthwise. For a proximal femur, top of the cassette is going to be where? Yes, at the level of the ASIS. Sorry, Nora.
Bed's moving behind me.
And rotate. Okay. This is an AP proximal femur. Notice the positioning, all of it. What did I do for an AP proximal femur?
Turn in her foot.
15 degrees.
Heels apart 10 inches.
Well,
That's
not so much for a femur.
for.
That's fine. That's fine, April. You put your heels 10 inches apart, okay? AP proximal femur, you collimate down to the individual femur. The top of the cassette is at the level of the ASIS. My marker's on the table, and I've collimated again from side to side so that we're just on the one femur, okay? Foot internally rotated, like you said. Now, I'm going to do a AP distal femur. You can relax. Not including the hip because we just got it. So, two inches of light below, or 2 inches of cassette, below the knee, AP knee, and we don't internally rotate the foot for the distal. Okay? Question? Can you turn that down to 67, please? And then ask your question, please. The light, or the air, sorry. The light! The knee.
Correct.
Yes.
So the bottom margin is where they fix the knee with 2 inches, right? The
Yeah.
bottom margin of the IR?
Yeah.
Oh.
Yeah. Okay. Now we're going to do lateral. Where did I put my marker? There it is. Sorry. Okay. Sure. Just don't drop it on my foot.
No, you're good.
Great.
I'm sorry. We're looking at each other. It's just funny.
Nobody pay attention to that.
Yesterday I asked her for her number when I was laying sideways.
God. All right. So 2 inches of cassette again below the knee. I'm actually going to fudge down just a hair. So we got the full 14. Distal femur, lateral. Okay? And tell me if I'm doing anything wrong. Questions? And since we did a distal lateral, we have to do a proximal lateral.
So is proximal and distal lateral different sizes?
Yeah.
Yes. You piece it together, unless you're very lucky. You can get somebody on the whole.
Learning.
Why does she do it on one?
Yes.
I don't trust her.
Okay, so the distal ones are on the 10 by 12?
Yeah.
Son of a biscuit.
I heard of that one.
Because your distal is basically a knee X-ray
Okay.
with
Just
not,
yeah. Okay, gotcha.
with more femur than tip bit.
Okay.
And as you can see for the lateral proximal, Nor has come up off of the opposite side hip. So she's rolled a little more onto the right side because that's the affected side that we're imaging, so that we can get this femur kind of laid out in a lateral, okay? Top of the cassette is at the level of the ASIS again, okay? Collimated down to just the one femur. Okay? All right, now we're gonna do a pelvis.
Guys, foot rotation is the most important part of this. If you don't do the foot rotation, then it's not
nothing.
a femur, it's not a pelvis, it's not a hip. Because one needs to be AP and the other needs to be lateral, and if you don't do the AP, then it's basically two laterals, and the radiologist will get mad.
Very.
And then you have to go take it again.
They will come find you.
Got it.
Okay,
So
Nor.
we're doing AP
Touch your
pelvis.
toes.
Pelvis.
Notice the feet.
It says roll toes in 15 to 20 degrees inward.
Cool. AP pelvis. Okay?
And the exposure is taken on the suspended respiration?
Yeah. Suspended is fine. Just hold your breath, don't move. Okay, questions on that? Frog leg is just as easy. Touch the bottom of their feet together. Actually, bring both your legs up. And now bend your knees, touch the bottom of your feet, and now let your legs fall out to the sides. Okay?
My favorite stretch.
Yeah.
Is that the pelvic suppressive? I mean, pubic symphysis, CR?
It is in between the ASIS and the pubic symphysis.
But the frog one, they have it under pelvis, but then in Clever Learning it said hip. So that's pelvis and hip?
So
Or
for a hip, the routine most places is to do an AP pelvis and then a frog of the affected side.
okay.
Okay?
So this is a frog of both.
Mhm.
Okay.
But if the affected side is my right side, then this doesn't need to be frogged. I could just do it this.
And we would do it similar to how we did the lateral proximal femur.
Okay.
Okay?
So it's almost the same.
Mhm. So the positioning, there's a lot of congruency between them, you'll notice. So if you can do a lateral proximal femur, you can do a lateral hip really easily. Okay? And it'd be even better if this tube head would rotate, because what most people do is drop a 10 by 12 or 14, and then they turn the tube head to match the angulation of the femur, so that can be your lateral hip right there, the unilateral.
That on a portable.
Okay.
Oh yeah, that's good. Yeah. Okay, now I need to get my book because I don't remember. I have never done inlet before this program.
A what?
The inlet, Taylor inlet outlet.
I always angle. I do pelvis, and then angle up and angle down. I don't know.
I think that's it basically.
Yeah.
But it says there was a 40 degree, what do you say, called?
And we have to do Danielus Miller too. Yeah, so there's a cephalic angulation and a
And the inlet is the other one. The inlet is the opposite. Got it. Yes, I can get right.
So inlet is 40-degree caudal to the level of the aces, whether it's male or female. And then outlet is 20 to 35 degrees cephalid if it's female, 30 to 45 cephalid if it's male.
Okay. And still have the feet inverted on that. So which one is this one? Inlet? Great. That is the pelvis AP axial inlet. Thank you so much for reading the book. And what is the outlet?
Outlet is
For a female, it's 30 to 45 degrees.
cephalic.
Cephalic. Great.
1
Okay.
to 2 inches inferior to the symphysis pubis.
Okay. And to find the symphysis pubis, are we going to ever palpate somebody's symphysis pubis? No. What are we going to use?
Eyeballs.
Or the greater trochanter, which is at the superior level of the pubic symphysis. Okay? Or your eyeballs.
She's like a perfect fit. How'd that happen? She like fits right, like perfect.
Okay? Can I get one of you guys to hand me those long angled sponges over there? One of them. Thank you so much. That's perfect. Thanks.
Not this.
So an AP axial inlet is a cephalic view?
Inlet is 40 degrees caudate. Yeah. Okay, and now we're going to do the obliques of the pelvis. I think they're still getting the whole pelvis on this, if I'm not mistaken. Okay, great. And what's the centering on this one? I think it's 1 inch in.
4 inches distal to upside aces.
And then 1 inch. Is it 1 inch medial, or is it on the MSP?
No, 2 inches distal and 2 inches medial to downside.
Got it.
aces.
Okay. To downside aces.
Downside, yeah.
Jude. So, sorry. 2 inches down, 2 inches.
Oh, it's on the.
Okay. I think that's right.
She has a picture in the book. You have a picture?
Honestly, I'm already over.
And then that should be probably right because it takes like air of half, almost. Yeah.
I'm gonna get my bad guys. Sincerely apologize. You're way, man.
Okay, great. And if you can do one side, you can do both sides.
The central race, she said, was 2 inches distal and 2 inches medial to what is it? What did you say it was?
It's going to be 2 inches distal and 2 inches medial to the downside aces.
Aces, downside aces, and medial inside.
Mm-hmm.
The triangle she didn't put on there. It wasn't on there.
No, she didn't.
Okay, questions? I feel like I'm. Sorry? This is a Jude method, the pelvis posterior oblique Jude method.
But it has 2.
Yeah, so you do this one and you do that one.
On the
LPO, RPO.
oh, just the same one, just both sides. That's right.
Yeah.
Okay.
Thank you, Nor. Questions? I feel like I'm going to need to review Jude for myself. Questions?
And then hip is the same thing.
Shoot, I forgot the hip. I'm ready to go. I left all my stuff in here too.
So you use 10 by.
For a unilateral hip, yes.
Feet go inward.
Yes.
femoral hip.
No,
This is an AP.
hip.
Oh, AP.
And then frog is similar to what we did earlier. And ideally, what we could try to do is try to get that femur a little straighter on the table so that we can do this business here. Sorry, Nora, I'm not going to throw you on the floor, I promise.
No worries.
Okay.
And then this one is where you see the neck of your femur.
Questions? April looks stressed.
Stop stressing.
Alrighty, that was fun.
Make sure the weight is rolled to the leg that you're.
Yeah. Exactly. Okay. Pelvis. You're gonna go like this. She's like, don't overthink it.
Honestly, the book has so much information. Realistically, if you just make sure that the top of your cassette is at the ASIS for practically all the pelvis and the hip stuff, you're going to be on there.
Yep.
So just the feet and leg movement is the.
Yeah.
Except how this one like inward, because that's what we did was
The femur. Yeah, this is the femur. 15-degree foot. Proximal distal. And then you're gonna lateral. Same thing. Proximal distal. And then you're gonna pelvis, AP. And then you're gonna frog leg. I've never seen anyone do this. Okay, frog leg.
You've never seen anyone do that?
No.
Oh, I have.
And then AP axial inlet. Inlet and outlet is just a pelvis and U angle the two. And then RPO, or is RPO?
Yeah.
LPO. And then hip, you're gonna do the same thing as the femur, you're just gonna get the hip still. And then you're gonna frog it.
Excuse me. And if you're in an emergency room and you have a patient who comes in and one foot is like this and the other is 90 degrees to that,
Oh yeah.
this hip is broken for sure. Okay?
If their foot is like this and their leg is pointing up, do not frog them.
No.
Because they can die. Yeah.
You can actually, the shards of bone can cut the femoral artery.
So just shoot as is, and then see what's going on, and then I send it like that if it's completely shattered. And then from there, the doctor knows you cannot get a certain position because it's shattered.
That would be on like the order too, right? Like,
No, because they don't know.
No.
You're the first person to see it.
Lock in, bro, lock in.
Half of the time, the doctors don't even see you until after all the labs and X-rays come back, and then they usually.
they
It's
just
just
get like a
triage.
general idea and then they order and then you don't see it.
That's
But
what
most of the
happens.
time.
You like
Sorry.
have an idea of what it's supposed to look like, and even without X-ray, like if their foot, I'm telling you, is going out, and their leg is pointing straight, just don't
Yeah.
move, don't do anything. But a lot of patients also will be screaming and stuff, and nothing you can see on the first X-ray, nothing is like crazy wrong, so you can continue to manipulate them.
Questions? Also, real quick announcement, okay? So I realized last night that the plan for our schedule next week was for us to cover chapters 8, 9, 10, and 11 on Monday and Tuesday, and then have the midterm on Wednesday. I messaged Mr. Ubalde because I felt like that was ambitious and also not fair, because I wanted, and I promised you guys Monday and Tuesday to practice before your midterm on Wednesday. So the materials for next week have gotten shifted back slightly. I will update you in an announcement on Blackboard about that, but Monday and Tuesday next week will be for you to practice, period. Okay? Questions?
I think
You're welcome.
Did that before introducing us. I might have
April,
had a
you
heart
were
attack.
right here when I thought about it, okay?
Yeah, 'cause you would have got this email like.
Mad at me like it was my fault. So my Venmo will be on the board again, okay? So you can
That one you
Venmo
deserve
me.
a Venmo.
Thank you, thank you.
I have a question.
Yeah.
So whatever we're doing, this information this week is, so week 1 is going to be in next week. So it'll be new information next week?
Not until after your
the
midterm.
right? Okay.
Okay, and I will make sure it's clear in Blackboard what you have to do for next week besides preparing for your midterm, okay? Okay.
For next week, it's just chapters 1 through 7.
For the midterm, yes. Questions? Okay, let's have at it. Allons-y.